Shortly after I joined Veterans Affairs Canada, I attended an all-senior leaders meeting, and I was asked to bring with me what I saw as the single biggest issue facing the veteran population. And I thought, well, I'm new, I don't know, but if it's the single biggest issue, then if I talk to a few people, I should get the same answer. No such luck. So I lit a torch, figuratively, and I descended into the research catacombs under the Veterans Affairs headquarters. Not a real thing, but I did emerge from my searching and my consulting with one page. And no exaggeration, it was a single graph, and it showed the age distribution of the veteran population in 2030. Very different from what we had seen in recent decades. The overall number of veterans was diminishing, and the proportion of veterans that were older was increasing. We did not really fully comprehend what that might mean. Mais il était clair que l'avenir des services et des programmes d'Anciens Combattants Canada allait devoir être différent que ce que nous avions fait dans le passé. Et d'autres le voyaient aussi. Avance rapide jusqu'à aujourd'hui, et les roues commencent à tourner au ministère. Through planning, research, and expert advice, we want to position VAC to support veterans throughout this kind of demographic metamorphosis that we're seeing now. We want to be able to deliver the services in accordance with changing needs. Our keynote speaker this morning will help us look at the evidence that defines the issue, as well as evidence-based approaches for stepping up to the task. Dr. Samir Sinha is the Director of Geriatrics at Sinai Health System and the University Health Network in Toronto. He's a Professor of Medicine, Family and Community Medicine, Health Policy Management and Evaluation at the University of Toronto. He is also the Director of Health Policy Research at Toronto Metropolitan University's National Institute on Aging. Dr. Sinha is a Rhodes Scholar, highly regarded clinician, and international expert in the care of older adults. He is the architect of the Ontario government's senior strategy and the driving force behind the development of the national senior strategy. In 2014, Maclean's proclaimed him to be one of Canada's 50 most influential individuals and its most compelling voice for the elderly. Please join me in welcoming to the stage Dr. Samir Sinha.
Thank you very much, Nathan, for that very kind introduction, and it's a real honor to be here today. I want to thank everyone in the room who is in service, those who have served, and for those of you who've welcomed me today to just present around a population that I've had a great privilege of providing care to and think a lot about as we think about our demographic shift. I also want to thank in advance Dr. Garland, Dr. Pedler, Dr. Christoph, who've been very kind in helping me to understand more about our veterans population to be able to present this presentation. So I'm speaking, but there are many hands that helped me create a presentation that I hope you will like. So I've got 3 presentation objectives for you this morning. Number 1, I want to help us understand the rapidly shifting demographics facing Canada's aging veterans. Number 2, I want to focus and help us appreciate upon the unique challenges facing our veterans. And then number 3, I want us to help consider strategies and frameworks through which the challenges of aging veterans can be better anticipated and managed. So how is our population of Canadian veterans rapidly changing? Nathan started talking about this as he was looking at some of the overall stats as the Director of Research at VAC. Traditionally, I think when the Canadian public or folks, in general think about our veterans, we often think about our Forest Service veterans. We think about this population that by 1951 numbered 1.2 million individuals. By 2017, the average age was 91 years of age, and this is a rapidly diminishing population. What we often don't think about is those who've been serving after 1954 when we think about our veteran population. So these are what we are calling Canadian Armed Forces veterans. These are all Canadian veterans. But it's interesting because when you look at this demographic, this population, what Nathan was looking at when he was looking at the overall numbers, in 2003, this was a relatively young population, only 6% over 70 years of age. But by now, with the latest data that we have from StatsCan, we have at least 461,000 veterans in Canada with an average age of 61 years of age. And by 2026, it's projected that 1 in 3 veterans will be greater than 70 years of age. This is my territory as a geriatrician, and this is when we start thinking about the challenges that we can face as we age. Now, when we think about those who are being served by Veterans Affairs Canada, or VAC clients, if you will, we know that not every veteran is receiving services and supports. Not everyone needs those supports, but at least 1/3 of our VAC clients, for example, or war service veterans, are receiving some services. So that's just close to 8,000 war service veterans. When we look at our Canadian Armed Forces veterans, what we do know is about 24% are receiving some sort of services from Veterans Affairs Canada. And one of the insights we have that many of you may be familiar with is the last surveys. These have been a series of surveys that are done every few years by Veterans Affairs, and it really helps us get a picture of what our veterans need and who they are and what their evolving profiles are like. And what we know is that about 52% from the 2019, the latest survey data, showed that they were actively using health services. But when you start asking what type of services these veterans were using, 1/3 were using mental health services and 12% were using home care services. So again, we don't think about this younger population needing things like home care and that, but you can start seeing that these are some of the trends. Now, when we also look at the evolving health service utilizations amongst our recent veterans, again, we can see that in the last surveys that are looking more at our younger Canadian Armed Force veterans, so not the overall population, what we start seeing is that that while some service utilization has remained consistent, mental health visits have significantly increased over the last few years as well. And we know that 25% of the respondents to the most recent survey indicated they needed help with one or more of their activities of daily living. For those of you not familiar with the term, activities of daily living are the 6 basic things you need to be able to do to make it through the day. You need to transfer from a lying to a standing position. You need to be able to walk around your place. You need to be able to bathe yourself, toilet yourself, dress yourself, and eat something. So we're talking about 1 in 4 who are saying they're having challenges with one or more of those activities. We also know that 75% of respondents reported having a partner who was serving as an unpaid caregiver. I want you to remember that number, 79%, because we're going to talk about some of the implications as we think about unpaid caregivers and their role in the care of aging veterans as well. So what are some of the challenges facing an aging population of veterans? Well, we know that right now there's increasing rates of physical health and mental health disorders. We heard Minister Bennett speaking about this. Let me show you some of the numbers. So we know that when we talk about chronic health issues or chronic diseases, for example, we're seeing increased rates of chronic diseases such as hypertension or high blood pressure, arthritis, depression, and anxiety. We also know that recent era veterans are reporting higher rates of MSK or musculoskeletal and mental health disorders, but earlier in their lives, so not at the typical rates we would see amongst the general public. And we also know that there's an increased rate of medical release that's occurring, especially around MSK injuries and mental health disorders. So we know that evolving Canadian Armed Forces roles are also affecting how we're actually seeing changes in our population as well. We know that there's more exposure to trauma-related deployments than earlier peacekeeping missions, for example. I've just listed a few, but clearly there are many different services that are now seeing the changing nature of missions as well. We also, as was just being mentioned, with Hurricane Fiona, for example, another clear example where our Canadian Armed Forces members stepped up across Atlantic Canada to really help. This may not have been what people signed up originally to do, for example, when they thought they were joining the military, but this is an example of how our military are more likely to be serving us, especially as climate-related events will be increasing over time. One thing that I was quite grateful for, especially in my work as a geriatrician, was seeing how our Canadian Armed Forces stepped up, especially in some of our hardest hit long-term care homes across Quebec and Ontario in particular, but several Indigenous communities. And this was not easy work. And I also thank our armed forces because they were the ones who actually helped shine a light on the conditions in our long-term care homes. And if it wasn't for the reports that were being written, not to name or shame, but to actually say there are challenges in these homes that are threatening our mission to actually provide effective care. It was that voice that actually helped to raise a light and actually lead some of the work I'm leading for the Government of Canada, developing the new national long-term care standards. So again, it just shows these complex roles that people are playing, but all these different roles affect work on the job, but also affect health and wellness over time. So we know that the health profile of recent CAF veterans is also starting to change and evolve as well. So again, looking at our 2019 last survey, we found the following prevalence rates, for example. So we know that 57% reported having MSK problems, 26% reported having depression, 21% anxiety, 24% PTSD, and 17% reported having had a traumatic brain injury. And the key is that this data shows that all these prevalence rates are all higher than Canadians of comparable age and sex. So again, we're seeing that there are significantly higher proportions of these issues. We also know that the profile of our CAF veterans is changing as well, because when we actually look at the longitudinal data that we have, when you look at the 2013, the 2016, the 2019 surveys, we see that prevalence rates for all these issues are increasing over time. So we know that there's been a 45% increase overall for those reporting any mental health disorders, specifically a 42% increase for mood disorders, an 81% increase for anxiety disorders, an 85% increase reporting PTSD. And when we think about comorbidities, again, as a geriatrician, it's rare that I have an older patient who just has one issue. Usually there's physical and mental health disorders that are commingling. And we know that there was a 48% increase in the presentation of these issues together that makes managing the care of an older person that much more complex. And of course, as I mentioned before, there's been an increased rate in reported mental health visits from, for example, 24% to 30%, or an overall 25% increase just in the last 3-year period between surveys as well. So again, as Minister Bennett was saying, this is something that's being increasingly recognized not only by Veterans Affairs Canada and the military, but also by our broader government as well as something that we need to address, but we need to think about it more holistically as well. So what do we know about PTSD and aging? We know that older adults with PTSD may present with different or atypical symptoms, right? When we think about PTSD, sometimes we think about things that happen during, a deployment or some activity, and that probably it fades after a few years. What we do know is that some of the data that's coming out from various researchers are showing that, for example, a study of 120 Canadian veterans who had PTSD found that they were experiencing functional impairments and reduced quality of life 50 years after service. So we know that often that these issues that one might be diagnosed with early or later in life can be lasting and can certainly increase your risk of developing dementia or complicating a presentation of dementia. We also know that gaps in trauma-informed care and symptom overlap make PTSD and dementia challenging to diagnose. Often people say, this person probably has a mild cognitive impairment, or they have a neurocognitive disorder like dementia, when actually these might actually be symptoms related to depression, anxiety, or PTSD. And unless one appreciates military service or the nature of service, if someone is not disclosing, or if you fail as a healthcare provider to elicit that story, then you may be missing what the real diagnosis is and the ability to provide effective care and treatment. I do a lot of home visits, and you see some of the pictures here that have been taken. This was actually a picture. I allowed a Globe and Mail reporter and a photographer to follow me around in 2011. And this picture was taken by Mo Doran, one of the senior Globe photographers at the time. That's me. You can't see me, and I like that. But he was just following me all day long and taking pictures. But he was really touched by the story because this was one of my patients, Stephen, who has Parkinson's disease and was determined to stay at home. And he was able to stay at home for quite a long time. So he was bedbound, and that was his bed, and that's his Saskapole. But I remember the first thing I noticed, as I was looking at Stephen with his head towards the left there, was right above him was a picture of him when he was in service many years before, and how he and his wife were really pleased when I acknowledged that and honored that, and then started talking about what we needed to do. So it reminds us, again, how so many of our veterans, they're so keen to age in place and stay at home, and what can we do to honor that service and honor their care. So what we know about our population is that it's not only getting older, it's not only having more issues with MSK and mental health issues that challenge their care, but we also have to recognize the growing diversity, and that we heard about that yesterday during the keynote. And I just wanted to pick up on a few of these issues, because often underrepresented in discussions about aging veterans are about thinking about individuals from equity-deserving communities. So we know, for example, that in 1972, 2% of CAF members were women, but now approximately 1/5 of CAF members are women. We know that women represent 1 in 6 CAF veterans, but we know that when we think about the experiences around gender, race, sexual orientation, and aging, all of these factors are collectively understood, I would say individually, but also collectively within our veteran populations. And how does this affect kind of other aspects, such as the impact of trauma not related to deployment? We also know that when we think about our population being served by Veterans Affairs Canada, 12% are now female. We also know that 64% of our female veterans are between the ages of 40 to 69. So this is an aging cohort as well. And again, how are we anticipating the needs facing older women veterans? And we also know that females are being medically released from service more often than males, 45% due to mental health, 43% due to MSK issues. But we also know that women or females experience higher rates of issues, such as a higher rate of activity limitations. We know that 47 versus 36 of female versus male veterans are more likely to experience chronic pain and MSK conditions. We also know that 31 versus 23 of female versus male veterans are more likely to report mental health conditions. So these are things that we need to be focusing more on to, again, understand these gender gaps and how we can better address them as well. We also know that CAF female members are at higher risk of experiencing sexual misconduct, assault, or discrimination, and that can have significant mental health impacts well beyond release from service. And we know that our Canadian female veterans are more likely to be low-income earners, and U.S. data has shown us that U.S. female veterans are more likely to encounter homelessness and live in poverty. So as we start thinking about the fact that people may not be in service for a long time, may retire with, for example, smaller pensions, or thinking about life after service and trying to earn money for a lifespan that might be a lot longer than anybody expected, how financially secure will we be in retirement, and how do we start thinking about those issues as well? So how can we better meet the needs of our aging veterans? How do we plan for our next coming of age? We know that there are an estimated 461,000 Canadian veterans with an average age of 61 years of age. That's what the StatsCan data has said, and there could be even more veterans than that. We also know that within less than 5 years, 1 in 3 will be older than 70 years of age. We also know that today's veterans are going to live longer than previous generations. That's just biology, and that's what's actually just happening right now in our population with medical advances as well. But we know that our veterans are going to be aging with a greater level of complexity than the average Canadian. We know that right now from the last survey that there are greater levels of dissatisfaction with later life finances. Often people say, well, but veterans get a pension, for example. Veterans, are getting better supports than the average Canadian. For sure, but people are also living longer than ever before, for example, and most Canadians are realizing that they are not financially prepared to face retirement or a longer lifespan. So that's why we're seeing greater levels of dissatisfaction with later life finances. We also know that there are greater rates of mental health and physical health issues, and these will all affect later life functioning. And then there are greater challenges around enabling aging in the right place. So during the start of the COVID-19 pandemic in June, the NIA, we did a national survey just looking at Canadians' perspectives on where they wanted to age. And we found that clearly 91% of Canadians of all ages, but 100% of Canadians 65 years of age and older said they plan on supporting themselves to live safely and independently in their own homes for as long as possible. And certainly with what we were seeing during the pandemic in our long-term care and retirement homes, we found that 60% of Canadians had actually, and 70% of older Canadians had shifted their decisions on whether they'd ever want to live themselves or have a loved one live in a long-term care retirement home as well. So if I ever ask a room, how many of you aspire to end up in a long-term care home? Nobody ever raises their hand. But I'm sure if I ask, how many of you want to age at home, your hands are going to go up 60% or 70% quicker than they did maybe a few years ago as well. So we know that this is overwhelming what people want, and I can say that this is probably very much in line with what our veterans want as well. So what are the strategies and frameworks that can help enable healthy aging and aging in the right place? Well, right now, for example, Veterans Affairs Canada has a well-being framework, and it's very helpful because, again, it's thinking about these things that veterans have identified that are important. Things like having a sense of purpose, thinking about your finances, thinking about social integration, thinking about life skills, housing, culture, but also health. So thinking about how we do this, and I think this is a really helpful framework, again, thinking about how we move forward as well. But we also have to think about this broader aspect of aging as well. And as Nathan mentioned, one of the things that I was funded by the Canadian Institutes of Health Research to work on back in 2013 to 2015 was actually creating an evidence-informed national senior strategy. Now, we don't actually have a national senior strategy that's been federally endorsed, for example, but this has been the basis which the Institute for Research on Public Policy and several others and our National Institute on Aging uses our blueprint to say these are the public policy issues that are backed by evidence that we need to be working on if we want to think about how we can support enabling, for example, the future of long-term care in Canada. This is a report we published in 2019, but also thinking about the future costs of long-term care in Canada. And when we think about our national senior strategy, we really think, again, you'll see a lot of resonance with the well-being framework from VAC, but we talk about how every older Canadian wants to be independent, productive, and engaged citizens throughout the life course. How do we allow that? How do we support people to remain engaged throughout their lives? We also think about the importance of healthy and active lives, and it's not just about keeping older people healthy, but it's also remembering from a life course approach, how do we actually think about supporting people when they're younger to make healthier life decisions, for example, things that can help them stay healthy and well, but then also remain healthy and well as they age as well. And so when we think about this, when we think about the important opportunities ahead of us, we need to think about, with high rates of MSK issues or mental health issues, are there things we can do when people are in service to maybe stem that from happening? But then how do we also identify these issues early and support people so that they can age well with greater independence as well? We also think about the importance of care closer to home. How do we actually support people to age in their homes or as close to their homes in their communities for as long as possible, and what's the right mix of services needed? And then finally, how do we recognize the 8.1 million Canadians who are actually serving as unpaid caregivers to another individual? Right now, 1 in 3 people in the workplace is actually an unpaid caregiver. And you may have seen the recent report released by the Alzheimer's Society of Canada, their landmark study that showed that the average Canadian caring for a loved one with dementia is spending on average 26 hours a week doing so. So think about that. When we think about this population that's aging, that was going to start experiencing high rates of dementia with time, just naturally happens as we age. And again, what that impact will be when 79% are already saying that they're relying on an unpaid caregiver for help. So we think about our approaches and how we've been supporting veterans. In particular, if you're a war service veteran, and if you're a Canadian Armed Forces veterans, there's been supports for people who need to be in a long-term care home. And of course, that population has been evolving. The orange bars represent our war service veterans, for example. Our blue bars represent our Canadian Armed Forces veterans. And while the overall population is decreasing significantly, with time as our war service veterans continue to age, for example, what we do know is, again, it's how do we think about the services that we're providing, because now many Canadian Armed Forces veterans who need long-term care services are now using the services that have been created by our provincial and territorial governments afterwards. But right now, when we think about long-term care in Canada, we have no agreed standards. We know that by provinces and territories, they differ significantly in terms of qualifying criteria, in terms of access, in terms of those supports as well. So again, this creates a challenge for how do we access the right mix of services that are available and around. When we think about long-term care, often people immediately go and think about a long-term care home or a nursing home. But what we've tried to do is, again, redefine kind of how we think about long-term care in Canada, because it shouldn't just be thought about from a long-term care or nursing home perspective. If you look on the international policy frameworks, for example, from the OECD or the WHO, or even in the United States, for example, we really think about long-term care as long-term care that can actually happen anywhere. So we talked about those ADL supports, but it could also be higher level supports like housekeeping, help with laundry, for example, help with transportation around one's community, those IADLs as we call them. It can be care that can be occurring in any place, such as your own home, or in a building, for example, like a long-term care home. And while we think about care often being responsive, someone needs a bath, so we'll help them take a bath, for example, we often forget about the preventative aspects of long-term care, things that can actually help reduce the incidence of falls, for example, or other things that can actually help people access services earlier that actually help them from experiencing more functional declines due to mental health or physical health issues as well. We also know that when we start thinking about, and this is a survey of Canadians in general back in 2015, we know 63% of respondents said that their family was not in a good position financially or otherwise to help care for older family members if they needed long-term health care, and it worried them greatly. So again, it really speaks to the challenge that right now we haven't been doing a very good job as a country as a whole preparing our population for the aging challenges that lie ahead. This was data from 2019 that showed at that time over 430,000 Canadians currently had unmet home care needs. And this is what was driving these long wait times for our long-term care homes. And those numbers have now evolved to over 500,000 Canadians and 52,000 people on long-term care wait lists. But it makes sense. If you don't have enough care available to be able to care for in your own home, where else do you go? We also know that, again, sometimes policy experts will say, well, we'll just ask the family caregivers, to step up, right? If they're good children, if they're good spouses, they'll take care of their loved ones. The challenge is that we also have to think about our changing demography. We know that Canadians are having less children. I think a stat that we heard this morning at one of the workshops was that about 25% of veterans are living alone, for example, if I heard that correctly. And so the question is, if you don't have someone available, and we know that between now and 2050, there will be 30% fewer close family members available to provide unpaid care. So again, thinking about the caregivers as being our solution is not necessarily an easy policy solution, especially if they're not going to be available. And we also calculated that for the remaining caregivers who are around to keep meeting the current levels of unpaid care, again, 26 hours a week if you're caring for a loved one with dementia, they will have to step up their efforts by 40% by 2050 if we want to maintain that same level of family caregiving. So we can't take these things for granted. We need to better support our caregivers and think about them as part of an overall strategy. This is a framework that we outlined in that 2019 report. All these things you can get on our website. They're all publicly available and free. And it's really where we went a step-by-step approach, looking at things that we can do to help people at the bottom of this pyramid stay healthy and well in their communities. Lots of programs and services that are actually available and concepts that can actually help people stay healthy and well and engaged, such as the concept of age-friendly communities and other things that can support people afford the cost of living. But then thinking about progressive services and programs that can better support people as they're aging, especially and including those people who might be living in our long-term care homes. One of the programs we featured a few years ago was the Veterans Independence Program. Some of you may be familiar with that, but it's one of my favorite programs as a geriatrician, because whenever I ask a person, have you been in service, and they say yes, I'm like, thank God. Because honestly, no, I literally say that. If you read my stats, you know why I'm saying that. So this is a program here that was established in 1981, and it was really a response to really trying to meet the needs of World War II veterans in particular, close to 500,000 who they were thinking were going to need long-term care services, for example. It's a program that recognized that overwhelming preference, right? If you thought that people today want to age in place, well, people have always wanted to age in place for as long as possible. And recognizing that there was a cost effectiveness of enabling people to age at home for as long as possible. And the program uses a case management approach where a veteran, will be able to access kind of what civilians can access, but then are able to get an additional basket of services that can aid both veterans and their caregivers and is made available to them. In 2021, 88,000 veterans were enrolled in the program. And again, here's an interesting stat. Half of them were not older adults. So again, recognizing younger veterans who were in need of home care services or home support services. And when you look at the program costs, for example, of caring for that veteran in a long-term care home versus in this program at home, you can see the significant cost savings and why home care and home supports are a really good solution and really a program that has provided a real alternative for those who are long-term care eligible as well. An interesting model, a favorite program of mine from the United States, is the Elder Foster Care Program. My colleague and friend, Dr. Tom Eads down there, had created this, and I think it's a brilliant program. It was established in 1999 as a home-based alternative for long-term care for veterans. And up to 3 veterans, for example, can live with a designated caregiver in a private home with ongoing health care being provided by one of the Veterans Affairs home-based primary care programs run out of a VA center. So in many jurisdictions around the U.S., you have families who are saying, I've got a spare room, I cared for my dad or I cared for someone else. I'd be honored to care for a veteran. They receive some funding and they can bring a veteran into their own home. And this program has supported 6,000 veterans to date. Again, a real interesting and novel program to really support veterans who, again, do not aspire to end up in a long-term care home, but get all those additional benefits by living as part of a new family unit, if you will. When we think about aging with post-traumatic stress disorder and dementia, I highlighted this issue a little bit before, but we have to remember that veterans with PTSD and dementia, they need different approaches to their care. We know that right now there are gaps in training around trauma-informed care for aging veterans in Canada, and often we don't have appropriate training that thinks about the importance of telling life stories, appreciating kind of different strategies and approaches, and recognizing how we actually enact that. And one of the interesting programs that that's been created in the United States, for example, through their National Center for PTSD, is an education course, for example, for healthcare professionals around working with people who are living with dementia and PTSD. And again, we don't have kind of similar training programs like this in Canada that are being leveraged really to support the hundreds of thousands of people working with older people. So overall, I see this as a challenge, but I'm a hopeless optimist. I always see this as an opportunity, an enormous opportunity for how we start thinking and reframing our thinking about our veterans in Canada and how we can advance our agenda. So we know that right now we have a new cohort of aging veterans that are going to be challenged more than ever to age in place with the right mix of supports that they need to age well. We know that Veterans Affairs Canada has a tradition of being innovative in delivering models that both honor our veterans, but also better address their needs. And finally, while the well-being framework can certainly help support healthy aging, I think there's an opportunity to think about, well, we don't have a federal national senior strategy. I'm now sitting on the federal government's Ministerial Advisory Board on Dementia that developed a dementia strategy. The government just announced the other week that we're going to create a new aging well-at-home benefit, so I'm helping to work on that, developing the new national long-term care standards, but we still don't have that national senior strategy. But I always say, well, until they figure that out, no reason why we can't start figuring that out as a way to think about how do we take that well-being framework, how do we think about an aging strategy that can better support our veterans and better enable them to age in the right place. So this really is our time to lead, and I really thank you for your attention today.